Hello, my name is Corey Del Bianco. I am here with the Urology Care Foundation, and this month is Bladder Health Month. We are talking all things bladder health, bladder education. I'm really excited to have Dr. Courtney Rowe here from the Connecticut Children's Hospital. We're going to be talking about bladder issues in pediatrics as well as adults. So let's just start off. What makes the bladder cool?
So a lot of people think of bladders as just being a storage for urine, but they're actually really a lot more complicated than that. And I actually love the bladder. So bladders have a couple of jobs that they need to do. One of them is to store the urine, but to do so, they have to kind of store it and stretch more and more and more until they reach the quantity that it's time for you to void. While the muscle of the bladder is stretching out, the muscles down below, kind of around the neck or the base of the bladder and the pelvic muscles around it, kind of hold some tension to keep the bladder from leaking. Then when it's time to pee, there's actually a reflex, a voiding reflex that happens. And the way this works is that the bladder muscles then squeeze while the muscles below all relax. And that reflex is actually out of your control. So part of toilet training in kids is that you learn to prevent that reflex from just happening on its own. And you basically put that reflex under your control so that the bladder squeezes and the muscles relax when you choose to have that happen.
So now I know it sounds obvious, but can you explain what bedwetting is and when you should contact a doctor in children and adults?
Yeah. So in kids, we often talk about bedwetting like accidents. And in adults, we often talk about nocturia, which is, usually not accidents, but often getting up at night to go to the bathroom. And they're a little bit different, but also really similar. So the first thing to say about bedwetting in kids is that it's super, super common. And we don't talk about it much in our society. So I think a lot of people think that their child is the only one going through this, but it's actually 5% of 10-year-olds. So if you take your average fifth grade class of about 20 kids, one of those kids is still having accidents at night. So super, super common. Some of the most common reasons that kids can't wake up overnight when they need to pee are actually very similar with reasons that adults may have problems peeing overnight. So they include kind of behavioral habits where you're not paying enough attention to the bladder during the day, so you kind of get into bad habits. And they also include drinking too much water overnight. And if you kind of think back to how the bladder works, the way we toilet train is that our brain basically tells that bladder reflex to pause and tells you not to go to the bathroom. So no squeezing, no relaxing down here. But it takes a lot of effort to do that while you're sleeping. So if you kind of think about your average child's brain, when they're sleeping, they are just completely asleep and they might be like totally exhausted. But somehow during that exhaustion, their brain has to tell their bladder, don't squeeze. And then if their bladder can't do it anymore, their bladder has to tell their brain, we can't do this anymore. You need to wake up. So if that signal isn't happening appropriately, that's when you have those nighttime accidents. So some of the best things that kids can do to grow out of that sooner are to make sure that they're paying a lot of attention during the day to their bladder. So really never holding the bladder, really going regularly on a schedule and really kind of reinforcing that brain bladder connection. And then the other thing that's really helpful is just making sure that there are no confusing signals in the area. The most common confusing signal in the area is actually being constipated, because here's your bladder trying to figure out, when it's full, when you need to go and communicate that back and forth with your brain. If behind the bladder, you've got a bunch of stool, a bunch of constipation pushing on the bladder, it's going to make that bladder really confused and they can have a really difficult time knowing when it's time to go. So fixing that constipation, paying good attention to the bladder during the day are really the keys to growing out of nighttime accidents. You asked about when parents should reach out to doctors. Well, it's really up to the parents and the child. It's incredibly rare for nighttime wetting to be a medical problem that's a danger without some other symptom. So, if you've got a child who's otherwise a totally healthy child, and this is just the one thing, it's pretty rare for it to be something like a diabetes or something like a neurologic condition that would impacting the spine. So the vast majority of time, it really just has to do with, that brain bladder connection and maybe some constipation and bad habits. But I usually say the right time to talk to a doctor about it is before it becomes a problem. It's because children develop at like a really wide range. And so that nighttime wetting can be very stressful for the child on a social and emotional level. And we really do have a lot of tricks to help kids grow out of it, from bed alarms to daytime schedules, constipation management. So the best time to reach out for more help is before it becomes a problem, before that child is, missing out on sleepovers or camps or anything else like that. Now, nocturia, or making more pee at night, is something that impacts adults. And usually in adults, they do wake up for that because most people outgrow the nighttime accidents, at least before college. But in adults, they can be making more pee overnight. And some of these issues can impact kids as well, but they're just a little bit more common in adults. So in addition to, drinking too much at night and bad habits during the day, adults can have a series of other things like medications that make them make more urine at night, medical issues such as high blood pressure, heart disease, or a sleep disorder like obstructive sleep apnea. And all of these have their own mechanism that they cause you to make more pee overnight. But they're things that we can help with as well. And so usually what we say in adults is if it becomes bothersome, if it's really impacting your lifestyle, it is worth seeing a doctor about that to see if there's some easy or straightforward fix that can be done to make it better.
So another topic we want to cover is bladder exstrophy. So what is that exactly, and what symptoms should someone be looking out for?
Yeah, so bladder exstrophy is a really rare condition that impacts about 1 in 10,000 children, in which the bladder is open to the front of the belly. So if you kind of imagine that circle bladder here, with the pubic bones kind of right here and here, everything is open and the pubic bones are on either side. So kind of looks like an open book. And then when the urine is made by the kidneys, it kind of drains through the drainage tubes, the ureter, and then it comes out into that open bladder and goes straight out to drain into the abdomen or the front of the child. So what we do as urologists is that we kind of take that open book and we close the book and kind of reform the bladder into that circle and pull the pubic bones together as well, so that the urine can be collected inside the body as opposed to outside the body. So in children, the most important things that we watch out for is how well the bladder functions. And if you remember how cool the bladder is, it does a lot of very complicated things. Sometimes when the bladder develops open and then we close it, it has a hard time doing some of those jobs. So either a hard time storing the urine at appropriate pressures, keeping those pressures low so that it doesn't impact the kidneys. Or sometimes it has a hard time squeezing to get the urine out. And then the same thing with the muscles below. Sometimes they have a hard time squeezing, or sometimes they have a hard time relaxing. And so in children with bladder exstrophy, one of the things we're doing is just watching to see how that rebuilt bladder functions in the future and how we can support it for kids' health. For adults, it's a little bit different. Adults, usually by adulthood, adults with bladder exstrophy have really got their bladders well managed, however that's going to be, whether they're voiding out of the tube that they pee out of the urethra, or whether they're using a catheter either through the urethra or through another reconstructed channel. And then in adulthood, it's really a conversation about sexual function and fertility. I think that we've really progressed pretty far in terms of managing bladder exstrophy. If you look back, 100 or 50 years ago, it was a pretty difficult condition to manage. But now today, most of these kids are doing really well. They're going to college, they're getting married, they're dating, things like that. And so one thing I see with some frequency is kids or adults now with bladder exstrophy, having kids, getting married, and talking about those aspects. So in the men, it has to do with just making sure that rebuilt urethra is able to carry sperm out, or if there's another way to access sperm so that they can have children. And then in the women with bladder exstrophy, it's about carrying a safe pregnancy, and making sure that that pregnancy and delivery which is generally often a C-section, just making sure that that's healthy for both mom and baby. So I'm seeing a lot more people with bladder exstrophy, men and women, coming back as parents. And that's always really exciting to see, to kind of see them doing so well that they are able to kind of focus on that as the next phase.
Thank you so much for that. Now, what other bladder conditions do you think are important to highlight this month?
Yeah, I think a big one that we haven't talked about is bladder accidents, and we see those in kids and in adults. And I think there's both similar and very different reasons for them. I think one really important thing to talk about with bladder accidents is just how rarely we talk about them. I think maybe in pediatrics and kids, people are more willing to talk about them, but in the adult world, people are pretty shy about telling their doctors about having accidents. And again, similar to other conditions we've talked about, it's kind of important to tell somebody about it if it's really bothering you. If it's something that just happens every once in a while and you wouldn't want any sort of treatment for it, well, that's one thing. But I meet a lot of people, both kids and teens and adults. Back when I took care of adults, they're kind of dealing with bladder accidents for years and years, and they haven't mentioned them to anybody. So it really is something worth bringing up and talking about. The cause for bladder accidents can be very different. In kids, it's much more likely to be something behavioral, in terms of just how they're learning to toilet train and kind of getting that connection between the brain and the bladder figured out. In teenagers, we do see a lot of actually stress urinary incontinence. Typically in our society, I think we think of that as something that happens to older women. But what I always say about the female pelvis is that it's designed for, a lot of really wonderful things, but holding urine in is really not one of its specialties. So there's actually some pretty good research showing that a quarter of female gymnasts leak urine when they perform gymnastics. And so, that's something that we can really at least talk about and have some strategies for, and girls don't have to be dealing with that without support. And then, of course, those numbers just continue to go up through life. Certainly, the incidence of urinary incontinence goes hand in hand with things like women who have had children. But there are plenty of women who haven't had children who are having struggles. And there are also a lot of men having struggles with incontinence due to BPH and other prostate issues. So that is always kind of increasing over life. And it's definitely something that's worth talking to a doctor about if it's becoming bothersome.
Well, thank you so much for joining us. I know I learned a lot, and these are a lot of topics that are really important to talk about.
Thank you for having me.